we have been inspired by through the Access to Medicines Foundation is the question on how to build up social business models for low and middle income countries. And we've just decided to form a global health unit which will particularly, not exclusively, but particularly cater to the needs of patients in more than 50 countries in which Bayer Pharmaceuticals does not have a legal entity.
Actually, very concretely, Access to Medicines Index sharpened. It sharpened the awareness of what are the real challenges in those countries. And it's also actually a pretty good benchmark for what other companies are doing. So we're also looking at what are solutions that other companies develop, because in the end, if you want to improve access, it's not about a company solution. It has to be a solution that works for the patient and for the systems. So it's a mix of stealing with pride and using it concretely to identify either sharpening processes, making different decisions, starting different discussions, and very concretely for Roche, what Access to Medicines Index really helped is raising the awareness for the need to improve access in low and middle income countries and the challenges that they are facing.
The Access to Medicine Index is a very comprehensive assessment, and it shows that many different elements are necessary and contribute to access to medicines. And this is very helpful in our internal discussions when we talk to the different teams, the different functions, or the different teams in the countries, because it helps to create an understanding what everyone's specific contribution to access to medicines is. And that it's not just a topic for you if you work in market access or if you work in sustainability, that everyone contributes to access to medicines or can contribute. It is a benchmark. It clearly shows us what the best practices are and also what the opportunities to improve are for us as a companies. And we use these insights when we plan and implement new programs and initiatives, and simply to continuously improve what we do.
The insights gained through the Access to Medicines Index really serve as a bit of a North Star in terms of best practice and what could be done to expand our work in access to medicines and in global health equity.
Being highlighted by the report, what it allowed us to do was identify gaps in knowledge that we at Biocon Biologics had in terms of registration, pre-qualifications, and how could we use that information to improve access to our medicines, to Biocon Biologics medicines in emerging economies, and improve awareness of Biocon Biologics products and brands in areas such as Sub-Saharan Africa. And to be honest, we have been very successful in this initiative thanks to the report.
I'll give you an example of how we're using some of the insights. Last year when I was here, there was a very powerful story from a person living with diabetes in Uganda. I think her name was Edith. And I've been telling that story internally, backing it up with some of the data points of the realities of what's happening in different countries. And when you start using the stories and the perspectives and sharing those internally, it allows for better decision making.